Introducing the Caspian Spinal System, featuring Mini Denali from K2M, Complex Spine Innovations. The patient's position is always up to the discretion of the surgeon, but most commonly, patients will be positioned prone. A standard midline exposure of the cervical and/or thoracic spine portion that is to be fused is then performed. Hooks are typically placed caudal. However, in some instances, they may be placed cranial. The implant may be inserted with the hook holder. The desired entry point of the pedicle is chosen and then perforated with an awl to expose the underlying cancellous bone. The entry point is then cannulated with the small pedicle probe. Prior to drilling the pilot hole, determine whether the fixed drill guide or adjustable drill guide will be used. Fixed and adjustable drills are available in both 2.3 and 2.8 mm diameters. These diameters are equivalent to the minor diameters of the 3.5 and 4.0 mm screws, respectively. Fixed drills are available in 12 mm, 14 mm, and 16 mm lengths, and are color-coded by length and diameter. Check pedicle wall soundness with the ball tip probe. Taps are available for both the 3.5 and 4.0 mm diameter screws and are undersized 0.5 mm relative to the major diameters of the screws. Slide the tap sleeve slit side first over the threaded portion. During tapping, as the tap penetrates, the tap sleeve will begin to slide up the tap, displaying the current depth. Use the depth gauge to determine pilot hole depth and correlating screw length. After the pedicle screw pathway has been prepared and proper screw size has been determined, load the implant for screw insertion using one of the Mini Denali screw inserters. Once the Mini Denali screw has been loaded, insert the screw into the pilot hole until desired depth is reached. Disengage the screw inserter by turning knob above the sleeve counterclockwise. Once the appropriate Mini Denali screw has been inserted, the housing of the screw can be adjusted with the Mini Denali head adjuster if necessary. The appropriate rod size may be determined utilizing the rod template. If it is necessary to cut the rod, the ratcheting rod cutter may be used. The final cut rod will measure 3.5 mm longer than the visible length of the rod from the flat surface to the end of the rod. The rod bender may be used to contour the rods to the desired amount of lordosis or kyphosis. Once the rod is bent to the desired contour, insert the rod into the Mini Denali screw heads using the rod holder or rod-holding forceps. In instances where a translational or reduction force needs to be applied to the rod, the left or right torsional rod reducer may be utilized. Using the provisional driver in conjunction with the anti-torque alignment tube, provisionally tighten the Mini ATR set screws. The Mini Denali screws offer a number of ways to introduce and reduce the rod. For quick and simple rod introduction techniques, the rod fork may be utilized. Engage the Mini Denali screw head by placing the rod fork over the lateral part of the implant. Once engaged, tilt the rod fork to reduce the rod into the implant housing, and then insert a Mini ATR set screw. For reductions up to 10 mm into Mini Denali implants, The firefly may be utilized. When docking the firefly, rock distal tip medial to lateral onto mini Denali screw head. Once the instrument is docked, squeeze the handle to reduce into the implant housing. You may also achieve a more controlled reduction by threading down the knob until rod is fully seated. A mini ATR set screw may now be passed through the center and threaded into the implant housing and provisionally tightened. Upon provisionally locking one or both screws, the compressor or distractor may be applied to restore the appropriate amount of lordosis or kyphosis. To final lock, attach the torque limiting shaft to the torque limiting handle. Place the anti-torque alignment tube over the implant housing and pass the shaft through and final tighten. If unlocking is necessary, the provisional screwdriver, in conjunction with the anti-torque alignment tube, may be used to loosen the mini ATR set screw. If screw height or screw removal is necessary, the screw height adjuster may be used. The mini Denali screw heads allow for off-axis screw height adjustment. Insert the screw height adjuster into the driving feature of the screw head. Rotate counterclockwise to remove. The Caspian Spinal System, featuring mini Denali from K2M. Complex Spine Innovations.